Hi everyone, welcome back to my channel. If you're new here, don't forget to hit the subscribe button and tap the notification bell. Today we're taking a deep dive into Narcissistic Personality Disorder, or NPD. Narcissism is a term that gets thrown around a lot these days, but the clinical reality of NPD is far more complex. So in this video, we're going to explore what NPD truly is, how it develops, and how it affects people. Let's jump right in. Narcissistic Personality Disorder is a recognized mental health condition that falls under the category of personality disorders. People with NPD exhibit a long-standing pattern of grandiosity, a need for admiration, and a lack of empathy for others. This disorder affects many areas of a person's life, including their relationships, work, and overall well-being. Now, when we think about narcissism, we might imagine someone who is self-absorbed, arrogant, or vain. But clinical narcissism goes beyond just these traits. NPD is characterized by deeper psychological patterns, including an inflated sense of self-importance, a belief that they are special or unique, and a persistent need for excessive attention and admiration. People with NPD often struggle to maintain close relationships because they tend to view others as objects that either serve their needs or are obstacles to their goals. This can lead to gaslighting, manipulation, and even emotional abuse in extreme circumstances. Now let's talk about where this all starts. Like many personality disorders, the exact causes of NPD are not entirely clear, but psychologists believe it's a combination of genetic, environmental, and social factors. One theory is that early childhood experiences, such as excessive pampering or extreme criticism, may contribute to the development of narcissistic traits. Children who grow up in environments where they are either constantly told they're the best or the worst may develop an unstable self-esteem. Over time, they might construct a grandiose self-image to compensate for deep-seated insecurities. Brain structure might also play a role. Some studies suggest that people with NPD may have differences in the areas of the brain responsible for empathy and emotional regulation. These differences could make it harder for them to relate to the feelings of others or to manage their emotions in a healthy way. So, how can you tell if someone might have NPD? Here are some of the core symptoms to look out for according to the DSM-5, which is the manual clinicians use to diagnose mental disorders. 1. Grandiosity, an exaggerated sense of self-importance. They often expect to be recognized as superior, even without achievements to back it up. 2. Preoccupation with fantasies of unlimited success, power, brilliance, or beauty. 3. Belief that they are special. They feel that they can only be understood by or associate with other high-status individuals or institutions. 4. Need for excessive admiration. Narcissists constantly seek approval and admiration from others. 5. Sense of entitlement. They often expect favorable treatment or automatic compliance with their expectations. 6. Exploitation of others. They take advantage of others to achieve their own ends. 7. Lack of empathy. One of the most painful aspects of NPD is the inability to recognize or identify with the feelings and needs of others. 8. Envy of others or a belief that others are envious of them. 9. Arrogant behaviors or attitudes. These behaviors are often deeply ingrained and manifest across multiple areas of life. It's important to note that just because someone displays a few of these traits, it doesn't necessarily mean they have NPD. A formal diagnosis requires a mental health professional. One of the most challenging aspects of living with or dealing with someone who has NPD is how it impacts relationships. People with NPD often struggle with intimacy. Their need for admiration and validation can turn relationships into one-sided affairs, where their partner or friends exist to serve their needs. Over time, this creates an emotionally draining dynamic. The narcissist may gaslight their partner, meaning they'll manipulate the truth or deny certain events to make the other person doubt their reality. This leaves the partner feeling confused, anxious, and often blaming themselves. People with NPD are also known for love bombing at the beginning of a relationship, showering the person with excessive attention, compliments, and affection. But as time goes on, the admiration fades, and the narcissist may become cold, distant, or even demeaning. Here's the tricky part. Many people with NPD don't seek treatment. Since narcissists often don't see anything wrong with their behavior, they don't think they need help. However, therapy can be beneficial for those who are willing to work on themselves. Psychotherapy, particularly cognitive behavioral therapy, CBT, is one of the main approaches used in treating NPD. Therapy aims to help the individual understand the roots of their behavior and how it affects others. Over time, they can learn to develop healthier, more empathetic relationships. It's also crucial for individuals around the narcissist, whether family, friends, or partners, to set boundaries. Codependency and enabling the narcissist's behavior can further entrench harmful dynamics. Support groups or individual therapy can be immensely helpful for those affected by someone with NPD. So there you have it, an in-depth look at narcissistic personality disorder. It's a complex condition, and while it can cause significant distress to both the person affected and those around them, understanding it is the first step towards healing. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might need to hear this information. And of course, if you haven't already, subscribe to the channel for more content on mental health, personal growth, and self-care. Thanks for watching, and I'll see you in the next video.